My name is Mohammed Habsah. I'm working as health advisor at the Canadian Red Cross. I will take you in this presentation through a completely different angle rather than the technical discussion we just had. So discovering or exploring other alternative careers that IMGs could consider if they decided to stop competing for matching or while waiting for getting their credential verified or finalizing their licensing process. So I'm just exploring with you the work that Canadian Red Cross has done for integrating international medical graduate, including refugees. So the outline of my presentation will cover some introduction. I'll give you a quick introduction about Canadian Red Cross work and also the experience we have with IMGs. So for the Canadian Red Cross, I would like to just highlight some uniques about Canadian Red Cross. Unique status. So Canadian Red Cross was created by an act of parliament to work as an auxiliary body for the government during emergencies. Unique ability. So Canadian Red Cross has a strong connection in all jurisdictions within Canada, strong partnerships with many organizations, and Canadian Red Cross can leverage all these abilities to respond to people's needs during emergencies. Unique mission. The mission of Canadian Red Cross is to prevent and alleviate suffering, especially during emergencies, and strengthen people's resilience. Canadian Red Cross is a part of a big movement called Red Cross Movement. Red Cross Movement, so far, they have more than 80 million volunteers and staff across the world. They have more than 192 national societies, part of this big movement, in addition to the IFRC, International Federation of Red Cross, and International Commission of Red Cross. So, and the work for emergencies is done according to the fundamental principles of 7 fundamental principles of the Canadian Red Cross, including humanity, neutrality, impartiality, universality, and volunteer work. There's some findings of a recent research published early this year. It's absolutely expected. This is self-reported surveys for unmatched IMGs. All of them reported limited number of residency position. All of them reported inadequate knowledge of their career prospects once they arrive in Canada. All of them indicated, or most of them indicated, the available information don't match well with the reality. Educational resources for unmatched international medical graduate are scarce, and most of them reported significant impact on their mental and psychological health. Then let's move in the second section to the experience of the Canadian Red Cross engaging IMGs. I will start by talking about the motive, why Canadian Red Cross is interested in integrating IMGs in their work nationally and internationally. So the first one is they believe that IMGs represent a vital reservoir within the country in response to public health emergencies or any general emergency. They believe that they could easily bridge the gap within the health system, the shortage that our health system is usually suffered from. So they also believe that career support, especially for alternative career path, can be built on the services they are usually providing in different jurisdictions within Canada. And also they believe continuous education and capacity building of IMGs should be prioritized by all decision makers at all levels. So examples of support that Canadian Red Cross has been providing to IMGs. For the past 10 years, CRC has frequently used IMGs for their international operation. Over the last 5 years, CRC has leveraged IMG experience in key full-time roles. I myself, full-time permanent staff at the Canadian Red Cross, just arrived 5 years in Canada. So from the day one, I think it will be bad investment if I invest my money and my time to get licensed in Canada. So I studied public health to get my master's degree and have my internship within the Canadian Red Cross. And thanks for COVID, they at COVID time, they think they need to have more staff. And exactly my last day of my internship was March 2021, when WHO announced COVID-19 at the pandemic. So they look in front of them, they found me, okay, Mohammed, we need you. Okay. So there's something good that COVID did to me. So in response to COVID-19, Canadian Red Cross has already mobilized hundreds of IMGs to support different operations within Canada and internationally as well. So we have diversity in our positions. So you could be as part of our roster. I will give you more insight about the roster. And also you could apply for international position to be deployed internationally in response to emergencies outside, part of our ERU, Emergency Health Unit. And also to apply for some positions within provinces or at the national office. So I'm not in the best position to talk about emergency health service. Maybe Yusra in a better position to talk about this operation. So I would like to seize this opportunity to say thank you, big thank you to Yusra. Yusra served during COVID response as the public health, GU public health lead in Ontario. She oversees many operations, supervised many IMGs mobilized across Ontario. So during COVID response, we have COVID testing operation. We supported different provinces to scale up their testing capacities. We did this testing within the province or also at the borders with the United States. So EBC, Epidemic Prevention and Control, IBC measures. We work in congregate living settings, in prisons, in long-term care facilities to review their standards, to help them zoning and providing them with some standards related to donning and doffing, hand hygiene. So provide training for their staff, vaccination, whether it's mobile clinic or fixed clinic, HHR, health and human resources, in response to shortage of healthcare professionals, and according to what the provincial regulations allow, we deployed some of our health professionals to remote communities in Ontario and outside to work with Indigenous people especially. So, okay, CRC utilization of IMG. You can think about our work in two different components. The first one is roster. Roster meaning a pool of IMGs, hundreds of IMGs ready to be mobilized in response to any public health intervention. They are not a staff within the Canadian Red Cross, but they are ready to be mobilized in response to any operation for 2 weeks, 3 weeks, 1 month. Okay, it's mainly inside Canada. Utilizing them outside Canada requires more training, more competitive process to be part, and also requires some sort of licensing. If you are going outside to provide clinical services, it requires at least the first exam, the first qualification exam, at least, to work as outpatient clinic doctor. So we have the roster. We have two main profiles: IMGs who are eligible to provide clinical services, and public health, only people who provide public health. And we have some long-term positions at our offices, including the headquarters. So selection criteria. If you are thinking to join Canadian Red Cross as a public health with no clinical eligibility to practice any clinical work, we will not ask you about any license, any medical degree. We just ask you about your understanding of the public health measures. So you should have a bachelor degree or postgraduate degree in medicine, nursing, public health, infection prevention and control, doesn't matter. Minimum 3 years of experience, fluency in English, training facilitation capacity, ability to liaise and cooperate with different stakeholders. And also it's extremely important to be agile and response to able to work in fast-paced environment and able to move across Canada. So you are not stuck in one province. You are able to go Manitoba for 2 weeks, British Columbia for 3 weeks. If you are thinking of having the authority to practice some clinical work, in this case, we need some mandatory documents like certification of medical degree, foreign credential evaluation from a recognized agency in Canada, and some desired documents like letter of good standing, LMCC within last 3 years, a strong communication skill. All these are assets, but not mandatory. So here are some statistics about our utilization of IMGs over the past 10 years. Between 2020 and 22, CRC recruited 327 IMGs and mobilized them in different operations. Of the IMGs, 60% has not previously worked in healthcare or health-related jobs in Canada. 208 IMGs were voted for clinical. They have already submitted their credentials and they have been approved to provide some clinical work. Long-term positions, we have 12 working in the headquarters, 7 males and 5 females. I myself, my direct supervisor, and the senior director of the unit, all of us are IMGs. So we have a lot of positions available and it's always posted on our website. So master degree, we also host some interns and practicum students for their master. We also work with some academic institution to have some doctorate and postdoctorate fellows have their fellowships within the Canadian Red Cross. So here are some recommendations. I put it in some shiny colors just to give some hope. Okay, so the first one, everyone should explore all alternatives, not focus only on clinical. And I'm going to this way, I have to get a result. Many times you will not. So be wise and don't waste your time. So explore all alternatives and try to understand the requirement of each one and try to go parallel for all options. You don't know when it will. So even if your licensing process will take 2 years, it's better to keep engaging during these 2 years until you get your license approved. So improve your skills through observership, volunteering opportunities, which is always available at the Canadian Red Cross. Right now, we don't have this work available, the public health work not available right now at the Canadian Red Cross. We already submitted a proposal to the government of Canada to continue funding Canadian Red Cross to be able to engage more IMGs, but the proposal has been refused. So we are exploring right now other opportunities within Canada to secure some fund to utilize IMGs, but volunteering opportunities are always available. So build a professional network. And I think this is the big objective of such meetings. Try to connect with other people, try to learn from their experience, try to put yourself in many WhatsApp groups and mail lists so you could get and secure some professional advice. Push yourself out of the comfort zone and try to practice hard homework. Continue to be up to date with your knowledge, medical knowledge, and also opportunities available in the and changes occurring in the market, local market. And my last advice is to be patient. Be patient. That's all. Thank you so much.